Welcome to the Doctors Making a Difference podcast, where we help physicians to be empowered with the tools they need to be successful in medicine, in finance, and in life. Join us as we highlight doctors and other professionals around the world who are making a difference. This week's episode is a little bit different. I was able to go to Uganda to work with Child2Youth Foundation at the beginning of June 2025. And the interviews in this podcast were recorded on site in Uganda. You'll note that the audio quality is different because of being recorded on site. I hope you'll be able to detect the amount of enthusiasm and excitement in the voices of those who are interviewed. The work being done with Child2Youth Foundation is amazing, and it's wonderful to return and work with this foundation that I've worked with off and on for the last 10 years. I invite you to listen, and I hope you'll enjoy it. Today, we're here with my friend Ronnie. We're in Uganda on the north shores of Lake Victoria, the second largest freshwater lake in the world, second only to Lake Superior. And we're in a beautiful fishing village here next to the shores of Lake Victoria, and it's gorgeous. The birds you can hear are going crazy. They're so excited about being here. There's lots of people that live in this beautiful village. And I was telling others on the trip, it's so beautiful here. If we were in California or somewhere in the United States, this would be the most premium property because it's right on the shores of this gorgeous lake with a beautiful view. And here it's a remote fishing village. These people are privileged to live in this gorgeous spot. But I'm here with Ronnie, who is one of the directors of the Child2Youth Foundation. I've known Ronnie for 10 years?
10 years.
Quite a while.
Yeah.
We've had several adventures in Uganda before. But Ronnie, why don't you introduce yourself to the audience so they can know who you are?
I'm Ronnie Kyambadde. I work as a social worker of Child2Youth Foundation. And Child2Youth Foundation, it's an organization, it's a charity organization that was started in 2005 with the knowledge of my dad having the knowledge of education. He wanted to reach out to many children who need help with education. Being a teacher, he saw that so many children were missing out of school because of school fees. So he initiated the foundation to be set up, and slowly it has been growing slowly and slowly. But one of the activities of Child2Youth Foundation, they have two programs or projects that are running. One is a child sponsorship, where the children are being sponsored. We get sponsors from all over the world, those who are willing to sponsor children from primary level to university level or tertiary institution. Those who would love actually to end in between, they can go and gain skills. So with this education, it doesn't apply only on school fees or the tuition, but it goes along with what the children will need for the school. When we talk about scholastic materials are provided, school uniform is provided, and also the shoes, the socks, the books, the pen and pencils, they are all provided so that the children can be comfortable in class.
I didn't know that shoes and socks were part of it, because I know we've done child sponsorship for lots of students, but it's the books, the fees, the tuition, the basic school supplies, the uniform, which includes shoes and socks.
We include shoes because at the one point we saw that some of the children may not feel comfortable going to school barefooted, and most of the schools actually at this moment children put on shoes. So we found out that our children they miss out a lot.
Yes.
So we decided to provide shoes and also the school bag where they can keep their books.
And that, my wife and I have helped sponsor several students for the last 10 years through Child2Youth. And the fee used to be about $330 per year. I think it went up a little bit this year just to try to make up for inflation. But it's, by US terms, a relatively small amount, but that pays for a whole year of school fees and all that stuff.
Yes.
Well, so Ronnie, one of the things I've thought about over the last 10 years as you and I have interacted is when we come for a week and support you and do medical clinics, we make a difference to maybe 2,000 or 3,000 people, or, you know, we impact the lives of a small group, but the foundation goes on and impacts many thousands,
Yes.
and you have a presence in those communities every week, in some communities every day. It's quite
Yes,
impressive.
that's right. Because for us as the foundation, we really want to go on the grassroots, where people actually stay.
Start with the
And
grassroots level.
yes, and be in position to see that the impact is being felt to the person who's the last one, the last person on the ground. We don't focus more on the leaders because, well, we work with them in order for us to have that harmony and a good relationship with them. But we've seen so many people that work with leaders, and at the end, the impact may not be felt because most of the leaders, they really want to gain something out of that.
Gotcha.
Yeah, so for us, we try as much as we can to go to the grassroots.
Right to the schools, right to the children.
Yes.
Right to the direct sponsorship of a child.
Yes, that's right.
Well, and if I'm right, Uganda doesn't have a large education system where children are automatically provided with schooling. Is that correct?
Yeah. Well, the government has, I think they are going to start that, the sponsorship of children, but the schools for the government, they don't have most of the facilities. They don't have most of, even the teachers. Teachers are always poor quality teachers. So you found that most of our children go to private schools, where private schools, they take care of good children, and they have the ability to see that the children, after their schooling, they can do something out of that.
Yeah, well, that's, they say you can't spend your way out of poverty, but you can educate your way out of poverty.
Yes.
And that's what I've really enjoyed working with you these last few years. The foundation has been in place for 20 years now,
20 years
from
now.
2005 to
Yes.
2025 now.
Yes.
But the impact that's left on these children, now many of the sponsored children have completed university studies and are working in various fields of employment.
Yeah.
And they pull themselves out of poverty piece by piece.
Yeah, actually, one of our lab technicians was actually a product of Child2Youth Foundation, and he has graduated and is now working with us.
That's been a fun thing this week.
Yes.
We've worked with that
Abdul
young man,
Katende.
Abdul. He has been
Yes.
a product of the program and is now serving back with Child2Youth and helping many people.
Yes.
Well, one thing I was wanted to ask you, Ronnie, is as we think about how the audience for the podcast are almost all physicians in the United States. And as I talk to people, sometimes people think like, well, how would I get involved in something like that? It's so far away from me, or I don't have knowledge of another language or another land. How would I get involved in something like that? And does it leave a lasting impact? So I wanted to hear your thoughts on what kind of a difference does it make, or how does it help you to have physicians from other countries come, or how would you suggest for people to get involved if they wanted to help?
Yeah, basically with Child2Youth Foundation, the good thing that Child2Youth Foundation Inc. is registered in Idaho.
Yes.
And that's the great opportunity, number one opportunity that we have, that through that Child2Youth Foundation Inc., we can be in position to get more people to come on board. Because the impact that we get when people see different people around, and they see the knowledge they give unto them, it really gives a great impact unto them. And in this way, we try as much as we can to see that these people, they come and they get exposed to the life of people living in Uganda, especially people from the village. So at the end, you see that the impact is being felt, and the people actually get what they need, and they feel like what we are doing is really right. It's really great.
Right.
Yes.
So when they come, well, they can. So people, the foundation will always use money. That's very helpful to sponsor children and
Yes.
and progress the work of medical care.
Yes.
And you have found that medical care and education must go hand in hand.
Hand in hand. Yes.
Because the children who have from these families with great poverty, if the family's in great poverty and can't send their child to school, the child doesn't receive an education. So the health, maintaining their health is an important part of maintaining education.
Yes.
But they have the Child2Youth Foundation in Africa, in Uganda, and Child2Youth Foundation Inc., which is a registered nonprofit foundation in the United States. And Ronnie's a part of both foundations, and it's a way for people to get involved monetarily. But like I think you said, when people come here on a service trip, we put them to work, but they get to see the impact that they're having, and it does leave an impact on those who are being served. And I think when we go home, people take home with them the knowledge of what it was like to be in the village with the people, working with the families and with the children. And this is very meaningful for both sides. It's not somebody coming from the outside saying we're better than you and therefore come do it our way. It's an exchange of cultural ideas, and we gained as much from it as we give.
That's true. Yeah, like we believe that, of course, to set up this service strip, of course, contribution needs to be done in order for us to buy the medicine, to run here and there, to get a registration. But also, at the end of the day, every penny that is being donated, we account for it. We do the accountability to see that there's transparency in everything. And with the Child2Youth Foundation, we set up a clinic whereby most of these sponsored children can go and get these services for free. Those who are staying nearby.
So the sponsored children get the service for free.
Yeah, they get service for free.
Health care for free.
Yes. And at the end of the day, even their guardians or even their parents, you see that they come and be in position to get these services. And even we have every Friday of the first of the month, that's when we get other people with diabetes and pressure, where they commune and be able to get treatment, which is not easy. We've done actually this for the past, I think 10 years, ever since you came here. We've maintained it. And you see that the impact that we get, people always love to come to this because the medication that we give to them is always of quality, not the quantity. Whereby they feel like, yes, we need to go back to the clinic and we get the medication because we know the medication where they buy it, it is really of quality, of good quality.
Right. What we bring to them, I mean, we've found in the last 5 days that we've been here, so many people that have never seen a doctor ever their whole lives, or if they have, it's maybe been a long time. And this podcast will include interviews from a couple of other folks. And we talked to a clinical officer who will do a lot of the follow-up. And so the follow-up care is really what moves the needle, because people, they get the care they need now, but we identify those with serious life-threatening illnesses, and they'll get the follow-up care, the surgeries, or the chronic care, or the referrals that they need. And otherwise, they simply wouldn't have that.
That's right. Yeah, that's right.
Well, Ronnie, it makes such a big difference, like what Child2Youth Foundation is doing in this part of Uganda. And I'm excited to see what happens, over the next 20 years. Think about what's accomplished in the past 20 years, and over the next 20, think how people take these services and they pull themselves out of the deep poverty cycle, which is really impressive.
Yeah, that's true. Because on top of that, we also do spring wells protection and water,
protect the water of a spring well,
and water and sanitation project or program that we have. This actually, so far we've protected over 35 springs.
Oh, really?
Between Mukono district and Buyuko district. But
that serves thousands of people if you have 35 large springs.
Yes. Of course, there are so many people that have been, individuals and families are benefiting from this, because we believe that in the communities, people have to get clean water. Yeah. These springs have been shared with animals, come and take and drink water, and also people come and fetch water to take for cooking, for washing. So we decided to protect those springs so that they can be able to get clean water. Funny enough that, well, it's not funny, but it's true. This spring actually give out clean water that you can drink direct, from the spring.
Right, directly from the spring.
Yeah, but most of the people actually do that, especially the children.
Yeah.
You don't need to cook. You don't need to boil water. You just drink because it's just from the spring.
Well, it's directly from the spring, from the ground.
It flows very well.
That's awesome.
Yes.
Yeah, Child2Youth does so many things: clean water, education, sponsorships, health, and they have social workers that follow up with these children in challenging circumstances. You mentioned projects where people are given a cow.
Send a cow.
And after the cow gives birth and they have a calf, they send the cow on to another family. And if the cow has another calf, then that cow goes on to another family. And I know there are similar projects with pigs.
The pigs, the goats.
The goat projects.
Yes, this is more like an income generating activity for the families and the community members, where when they have a cow, they can get milk out of that and be able to probably pay for school fees for their children, or go to health services and get the services that they need, or even pay now they have electricity, they can pay those bills.
Yeah.
Yes.
Well, that's what I wanted to spend this podcast episode highlighting, is the tremendous difference that this foundation has made for many thousands of people. And over the past 20 years, there's been so many success stories, and I'm interested to see what will happen over the next 20 years, or the next 50 years, next 100 years, as people do this kind of work. So if, I guess, Ronnie, would you, if somebody wanted to get involved, would you welcome them to come to Uganda, or how would you suggest for them to get involved?
Well, Uganda being the Pearl of Africa.
Pearl of Africa.
Yes,
yep, absolutely.
And we really welcome anyone to come in and join us, because we have a great cause to fight for.
Absolutely.
At the end of the day, if we give a little bit that we have, people will be blessed, children will be blessed, even the communities will be blessed. I myself, I studied development studies. I have a bachelor's in development studies, but that one happened after visiting different countries like England, you know, and when I served my mission there, I saw the development. The same development that I saw, I know we cannot reach at that level, but at least the idea that I got there, I want those same ideas to be within our communities, so that we can develop together slowly. And be in position to see that all people, they are happy, they are healthy, and their mindset is really positive.
Yeah, and it helps. Again, they say a rising tide lifts all boats. As we build, as this kind of work happens, people really, they just gain opportunities that they would have never had. And so, and I guess the final point I wanted to make with Ronnie is, when we've come before, this is my 4th or 5th time to come and to work with Child2Youth directly in Africa, outside of some of the sponsorship stuff we've done. When we've come, we have not brought wealthy people by U.S. standards. We just brought regular folks, and you made that point. People give a little bit of what they have, whether it's their time or their money or their resources, to help somebody. And you can't make all the difference, but you can make a little difference. And piece by piece, person by person, it's really impressive to see what can happen.
Yeah, that's true, because we believe that if we work together jointly, we can create a great impact with that.
Yeah. Yes. Well, Ronnie, I want to thank you for what you do here.
Thank you so much. We really love you, and
thank you.
We know that every time you come here, keep us so blessed.
Thank you, Ronnie. And likewise, I'm just always delighted to see you and your dad and other members of the organization, because I know people are blessed by the service, by the work you're doing.
Yeah. We appreciate, and we call upon all those who could be able to join us. Please join us and be able to make an impact to this great cause of reaching out to our needy children and also the communities. Because at the end of the day, we believe that Heavenly Father will be able to bless us in everything that we do. This service is not for us alone. It's not us to benefit. It is actually the children and the community members to benefit from this.
Absolutely. Yeah. Ronnie, thank you. I'm so appreciative of what you do, and I thank you for taking the time to do this interview with me.
Thank you so much. Yeah.
Today, we're in the town of Si, spelled SSI, which is on the northern shore of Lake Victoria in Uganda. And I'm here with my friend Angela McKellar. We've been here for about 4 days doing medical service, and it's been kind of an exciting time, but I wanted to spend some time today with Angela, kind of highlighting why we do what we do. And
I'm Angela McKellar. I'm an ER doctor in Salt Lake City, Utah, and here with Peter for the week in Uganda. Yep.
Angela and I first met years ago. We were classmates in medical school, so it's kind of fun to reacquaint years later on a medical service trip. And we're in, like I say, in Uganda. This is an organization I've worked with off and on for several years, and it's really kind of amazing to see what they've developed. Specifically, we were talking before, when I first started coming, they just weren't very self-sufficient. They didn't have very much stuff, and over the last 10 years, they've developed so much. They've got more health professionals. I don't know if they're doctors, but they've got health professionals. They've got more nurses. They've got better resources.
The lab. They've really done an amazing job getting a good clinic going here.
Yeah.
Portable clinic, I guess. a
Portable
little bit.
clinic, yeah. I talked to one of the chief or health officers, I guess is what they call them, at the other site. And today we're at an outreach clinic in this town called C. It's actually quite beautiful. It's it's over 4,000 feet elevation, right by that beautiful lake. You can't see the lake because it's so misty and cloudy and green, but it is just a really beautiful, tropical place. But well, one of the questions for you, Angela, just thinking about this is why did you come? Why would you do medical service? You think about all of us that are doctors, have all these things we do at home and it's so busy. Why would you take time out of your busy schedule and fly halfway across the world to come and do medical service for people that are so far away from home?
Yeah, that's a good question. It's probably a complex answer, honestly. I think it's fun. I've always loved doing
part of it's fun, right?
It is fun. I've done stuff like this since I was an undergrad, but it's really fun to do it with a real training now to come and do stuff like this. I think that it's, obviously there's needs all around the world, including in our own communities, but it's really fun to come, especially work with an organization that's in the country, knows the ins and outs, knows what people need, knows how to make the system work in their own country, and to come and support as best we can. It's been really fun to kind of come do that. I also think from two other points why I probably do it. One is from a medical sort of nerdy standpoint. It's fun to actually see the diseases and things. Yeah. It's not fun, but it's very interesting to see some of these tropical diseases that we haven't seen or thought about since medical school, for a lot of us anyway. So I think just seeing how medicine is done and their different clinical guidelines for their specific needs has been just from a nerdy medical standpoint, it's been really fun and fascinating. And I think that it's good to kind of get a change of perspective too. I think burnouts hit a lot of us hard after COVID, and we have our own challenges with our each individual systems, and to be able to just sort of recheck in a place where most people never have access to any type of medical care. It really is a good reminder of just how lucky we are to even have been able to take out a loan to get an education and to come do this stuff. It really just makes you feel way more grateful, and to kind of a shift in perspective, just to be able to say, oh, I do have something that might be helpful for someone somewhere, because you don't always feel that at home for some reason. Which,
well, I think sometimes at home we're like part of the machine.
Right.
You have to order the tests, and you have to do this. You don't want to get sued, and there's this expectation that when somebody comes in for care, they're going to get a whole bunch of tests and a bunch of care. We're going to be really specific, which lends itself to more specificity in our diagnoses. Yeah. But it's really interesting here. Yes. The resources are so limited. All we have is like point of care tests, and just a few of them, and they use those a little bit more than maybe I would, but they use them a lot. But they can't go order a CBC. Right. You can't go order a CAT scan on somebody with abdominal pain. You have to go with your clinical diagnosis. Yes. And it seems different than what we have at home. Yeah. But it's also kind of fun to use those skills. Exactly. And I think it really helps people. Like, we are working along these health officers, in which they have some training, but they're the ones who are doing the work. Yeah. And when we leave, this organization has got a long-standing good reputation in these communities in this district of Uganda, and they're going to do all the follow-up care and the work, and the ones we identify that have like real serious health needs, it's going to be them that do the follow-up. And so they do come across a range of diseases we really don't see very much at home. And they're very self-sufficient, but it's fun to be able to help them get through bigger numbers with these bigger camps that we're doing together, with them, to kind of really reach out to more people than sort of the normal. So it's been really, really cool. Yeah, and I kind of don't think we could do that much good, long-lasting good, if we just showed up with a duffel bag full of medicines. It just really wouldn't move the needle. But working with this organization. Yeah, I love that it's a Ugandan organization from people who live here, and I just think they can make it be way more long-lasting and more effective in the long term. And we just are here to do what they want us to do, and however they need our help, we're happy to do it. Yes. Well, I'm just reflecting on what you said a minute ago. Like, doctors are weird. We're such nerds. And so we've each talk to each other like, hey, come see this interesting, crazy thing. Have you ever seen this before? And so it's academically, just personally fascinating. Yes. I think it's really interesting to see some of the diseases you studied about, and now you are seeing them. And it's also good, I think, to kind of escape the the craziness of the system at home.
Yes.
Even though it's good, it's nice to just, it's kind of pure.
It's just yeah, it's way more basic, and it's kind of cuts at the heart of the matter, if you will. You know, really gets to what people really need right now, and it's been really great. Yeah.
Yeah, and you're not dealing with some of the stuff like in my world, especially on the outpatient side, prior authorizations and whether this is going to get paid for by insurance, and the people here very much worry about money, like how much is this going to cost?
For sure.
But a chest X-ray here costs $2. I mean, a doctor that we hire to come and help these clinical officers, I think we pay them about $12 a day.
Okay.
You know, it's just it's just an incredible difference. And so we've raised some money from our local community to bring to help buy some of the medicines and stuff. And if we leave them $1,000, that will fund what they do, their operations for months.
Yeah.
I mean, it's incredible what they do.
Yeah.
The objective of we talked about before, the organization, this Child2Youth organization, is to keep kids in school. And what are your thoughts as you've observed the health side of it? Can you see how that helps, or what do you think how that connects?
It's education is just key to everything, especially in a country like this, for sure. Because talking to the health worker that I'm working with today was telling me a lot about how they do a lot of health education in schools, even just basic hygiene and things like that to even prevent a lot of diseases they get taught in school. So that's a part of their general education if they get the chance to go to school. So even that from a health standpoint is good, let alone that's kind of a lot of the only ways to kind of make money is if they do get that education, to get a little bit ahead from that standpoint, to be able to pay for medications for their children or all that stuff. It really just gives that much of a huge advantage to have had that education.
And we've found, just, you know, even here this week, or, you know, and the organization has found longer term, just like everywhere, you can't spend your way out of poverty, but you can educate your way out of poverty.
For sure.
And here, where there's not much of there's not really much of an education system or a health system like we would think of it. And so if these families can't send their children to a private school because they're unhealthy, then they just don't go to school. And the kids are kind of stuck in that same poverty cycle. So it is quite neat to see what they're doing.
Yeah, it's great. And I love that that's the emphasis of it too, and that this is sort of a appendage to it to kind of help with that medical stuff, because it can stop the schooling in its tracks if you get too sick or can't get, you know, the malaria medications or whatever you might need. So it really keeps it moving forward. Yeah, it's pretty cool.
What would you tell another doctor from home? And most of the people that listen to this podcast are physicians. What would you tell another doctor who says, I kind of want to try that? Like, is it worth it? Is it a waste of time? I mean, you've come on this, so something like this, you've done multiple of these in other countries as well. What would you tell someone who's considering it?
Just go do it. It'll even, you may have some expectations coming and doing something like this. No matter what, your horizons are going to get broadened, and in ways you're not going to even think about before you go. Whether it's just learning, meeting just wonderful people that are so different from you, but really not that different from you, seeing how other people live. If you, like we talked about the medicine and everything before, you really get a good sense of, it's kind of weird how quickly you can build community on one of these things, which is, I think, half the fun is really getting to know people, not just being a tourist in a country, but really going to where people live and trying to work with them as best you can. So just go do it. You'll gain stuff that you can't even think about, like you can't even prepare for, I guess, or you couldn't expect it. You'll just see so many different things. It's really a broadening of your horizons experience that is really, really cool to do.
I think just reflecting on what you said, I think these kind of experiences are so much different than when I've gone just as a tourist to see the highlights.
Big difference.
Because the people are trusting us with their children. I mean, the thing that's most important to them. And they invite us into their homes, and you're interacting with the people and these other caregivers. And I mean, you're right there with them for days and days.
Yeah, and they for whatever reason are so welcoming us in their communities. And it's been really, I mean, you just can't put words or value on that type of experience. It's just really, really cool.
I've come several times. I've just been surprised at the end of it how much I'm like restored by that. Like really, like my batteries are charged. Like I'm here ready to help you. Because it's a job. I need to get paid to do the job at home.
Right.
But if you kind of go back to like, why did I become a doctor?
Yes.
I wanted to help people.
Comes back to the core of why we put ourselves through this in the first place, and the long schooling and the hard hours that we have. It really does cut back to that kind of altruistic the thing that we all had on our personal statements. Why did we do this? This is why we did this. So it is rejuvenating for sure.
And certainly we can find echoes of that at home.
Yeah.
There's lots of opportunities to help people.
Yes, everywhere.
And you don't need to travel to Uganda to make a difference in your own
for
community.
Sure. 100%.
But I agree with you. It's just unlike anything else. If you take yourself out of the U.S. system for a little bit, go help some people that have some needs that really aren't going to be met unless you show up.
Yeah.
And we can't make all the difference, but every day we have found people that have stuff that it will kill them if they don't get the help they need.
Yeah, we're able to set up those interventions, and it's huge. Yeah. It's a good perspective shifter, if nothing else.
Right, and the little amount of money that we will leave that was raised, as part of the funding for this trip, and people that spent, I mean, it's just really not that money compared to U.S. terms, but that will fund all these people that need follow-up, if they need surgeries or specialist consultations or whatever it may be. It really will move the needle. And so that's what I've found is working with this foundation is so helpful. And maybe it's selfish. I love coming because it just helps me so much.
I know it is. It's a two-way street for sure. We get plenty out of this as well, for sure.
Thank you, Angela, for coming. Like I said, it's been so fun to kind of reacquaint with you over this.
It's been too long.
I know. We started medical school in 2004.
I know.
We're
getting up there.
All those years go by. But it's fun. Like we all kind of have that same core root of what we want to do.
But, that's awesome.
Well, thanks for taking time to do the
interview.
interview.
Come along.
It's awesome, and I think our listeners will really enjoy this because it's kind of fun to be on site. This is what we're doing it.
Yeah.
We have our little lapel mics, so it's maybe not quite as the same audio quality as what we do with the normal podcasting, but I think it'll mean a lot.
Cool.
So
Good.
thank you so much, Angela. Appreciate it.
Of course.
This is my friend Stephen. Stephen has been working with the foundation for 20 years. In fact, he is the originator of the Child2Youth Foundation. So I grabbed him for a minute in the middle of our busy clinic, and I appreciate him taking the time to sit down and talk about what this foundation is and why he started it. So would you mind introducing yourself to our audience, Stephen?
Oh, yeah. Thank you so much, Dr. Peter Crane. I'm Senyor Stephen, the proprietor director of this organization. The essence why I started this organization was based on my poor background, where my parents were really very poor. They had no money to educate me. However, because I was bright, the government sponsored me in my education, right from secondary up to university. Then from there, I graduated as a teacher, physics and chemistry teacher. Then after graduating within 2 years, I was given to be a principal of a secondary school. So in that secondary school, I met many poor children.
So many poor children.
Poor. So I reflected back how my background was. So what I did, I used to help them out of my salary to pay their tuition. And the number became too big.
Too big to do by yourself.
To do by myself.
Well, I mean, think about that.
Yes.
Stephen, you had this gift, you were bright, and you were able to become a teacher despite very challenging circumstances.
Yes.
And instead of taking that, this is my favorite part of your story, instead of taking that and saying, well, I'll just keep for me and mine, you said, these children are just like me.
Yes.
You could see yourself in them.
Yes.
And I can hear the emotion in your voice, but you could see what the impact was that it had been for you to have an education. So with your own salary, which is it's a small salary in Uganda, you were paying for the tuition of these children, and then it got to be so many, you couldn't do it on your own.
I could not. Because the number of children needed were so big.
So big.
Yeah, so that I had to find resources. I went to the government said, no, we cannot do that. So I had to start an organization, Child2Youth Foundation, where I could mobilize resources, talk to friends, talk to partners, so that they can bring in some money to educate these needy children.
Yeah.
So in 2006, that's when I registered this organization, and we started working. Good enough, I got a friend from Canada, called Art Baron.
Oh yeah, I know Art.
Who visited Uganda, and he was really, when I told him my story, he was really touched, and started sponsoring 26 children by that time.
Wow.
Yeah, so from there, we started moving forward. So as I was doing that, my son Ronnie Kyambadde went to serve a mission in Manchester, UK.
Yes.
Where he met a couple missionary called the Lukes.
Yeah.
Barbara Luke.
And I've been privileged to know the Lukes as well.
Yes. No, the Lukes were interested to know what I was doing, the father of Ronnie Kyambadde. So Ronnie told them what I was doing, and they were very much excited.
Yes.
So when they went back after their mission, they tried to look for sponsors, again to help children through Child2Youth Foundation. And they really have done and still doing a very good job. So from there, the program of sponsorship expanded, many children being sponsored. Then, within these poor children families, what we found out that they are lacking even medication facilities.
Right. They didn't have medication.
They didn't have medication.
They didn't have education.
They
had nothing. They grew up just like you did.
Yes, I did.
Very, very poor.
Very, very poor. So I talked to Art Baron of Canada, and he mobilized through sisters, they are called Sisters of St. Joseph, who donated funds to construct a clinic. Mm-hmm. Sisters of St. Joseph Clinic, Chambogo. So in support of child sponsorship. Then also from there, we found out that the villages had poor water sources. So we started what we call water and sanitation. So we are also helping people, community people to construct water sources.
Yeah,
we
clean water.
So they can have clean water. Then also we started another project called the Community Development Project, where we give the families of these children income generating projects. We are giving them pigs, goats, and cows. And the project is also flourishing very well, because in a family, you cannot sponsor all the children.
No.
Maybe you can take 2 or 3, then the remaining, also they need to have education and facility. So with that, now the program is moving forward.
Well,
and I'm so grateful to people like Dr. Crane, who has really participating, helping us a lot with the health facilities.
Well, it's my honor, my privilege to be a part of it.
Yes, please.
And like I said, Stephen, the thing that I was so impressed with when I first knew about the organization and met you is this wasn't a group of outsiders just coming in and deciding to try to make a difference in Uganda.
Yes.
It was Stephen, who grew up in a village and who I'll edit that out. The reason I was so impressed is because it was Stephen and your people who grew up in the village, who are from here, who say we're going to make a difference for our community and do it in a way that's sustainable and ongoing.
Yes.
And that's unique.
It is unique.
Because many people go to do service organizations and they'll come in with outside people and outside money and outside resources. And certainly you need those. But this is taking care of your own community, your own village, your own people. And I love it. I think you've dedicated your life to this.
Yes, and I'm seeing changes.
And you're seeing these changes.
Yeah, people are changing.
Yeah.
Now, for example, in our organization now, we're employing 2 people whom we sponsor in education.
Yeah, now you're employing them.
We're employing them. One of them is our medical lab.
Yeah, and there's many others that have not only finished primary, but secondary, and now university level education. And those folks, you couldn't have paid them the money, but you can give them the education, and they now have risen above that poverty, and they can bless so many others.
For sure.
Well, Stephen, thank you for what you're doing.
You're
I just love what you're doing, and I find this is not some made up story. This is the real deal. And when I come, and I see you, Stephen, I always know that I'm in the presence of greatness.
Yes,
this is someone who walks the walk.
For sure.
So
thank you so much.
Thank you.
We thank you so much, Dr. Crane.
Thank you, Stephen.
For also helping us, getting us people, volunteering,
thank you so
much. To provide their money, their time to come to Uganda and treat people free of charge. Thank you so much.
Of course.
I'm really so grateful.
Thank you. You keep up the wonderful work. I love what you're doing. We are here with Maureen. I'm going to have her introduce herself. We're in rural Uganda at the Sisters of St. Joseph Clinic. Pretty excited to be here. I want you to introduce yourself so you're saying your name correctly because I want to make sure I do it right.
Thank you so much. I'm called Maureen. Yeah, I'm a medical clinic officer working at St. Joseph Medical Clinic, located in Kyambogo in Buikwe district.
It's awesome. So I've been coming to the same place in Uganda off and on for about 10 years, and it's been really fun to get to know the Child2Youth Foundation and the team, and I've loved getting to know you, Maureen. You've been the one that's kind of been taking care of this patient population.
Sure.
We're kind of north of Lake Victoria in the rural areas of Uganda where there are tremendous needs, and whenever I've come here, I've observed that there are things that people, the ones who work here, are very good at treating tropical diseases, things that I don't see very often. And Maureen and I have been taking care of people a lot the last couple of days here. What diseases do you see the most here?
Yeah, mostly here, the commonest diseases, we have malaria, we have pneumonia, and in elderly, mostly we have hypertension and diabetes.
Yeah, I've been
It's so
surprised at
common.
how much hypertension and diabetes, a lot of the things that we see at home.
Yeah.
This podcast is mostly for doctors, and they'll agree, they'll recognize all this stuff. But when we talk about global health and being able to extend your reach beyond where you normally practice, this is a place where Maureen has tremendous experience treating malaria, HIV, diseases that we may not see quite as commonly at home. But it sounds like you see those every day.
Yeah, but the highest percentage we see is diabetes and hypertension. But sometimes we also get those tropical diseases. We have the helminthiasis.
Yeah,
We have
helminth diseases.
We have typhoid. We have malaria, STIs, sexually transmitted infections,
Yeah,
syphilis, HIV, gonorrhea. They are also common in our area.
yeah, we have a lot of that stuff. Well, so another question that I think is relevant to people who listen to the podcast is, why do you think it's important to bring a clinic like this, to a rural area? Like we do it at home. We have, in the United States, we have people that work in rural areas, but we're in a very rural area in a country that, has some places with excellent medical care and other places that doesn't. What do you think the benefit is to have a clinic located here? What are some of the challenges that people face?
Like you see our district, most of the clinics, the heavy health, the hospitals are really far from the rural settings, because now the nearest hospital, it is very far. In fact, it is not, the transport from here to the hospital is like 20,000.
20,000 Uganda shillings,
yeah.
right.
So it is very expensive and very far from the rural setting. So this clinic has really helped to serve the local people. In fact, it has managed emergencies. It has delivered mothers all over, because though some couldn't afford to go to the hospital because of the setting, the transport means. You see, we use motorcycles most of the time, and the motorcycles are also few.
Yeah.
So we enjoy the medical facility this way, because at least we can afford to get cheaper things at a cheaper price here, and almost services are almost free here. So this facility has really helped the local people to get medical care, to get better antenatal care, to get mothers who can deliver from here. So it has really saved the community from the burden of traveling to a very far where the hospital is located to get medical services.
Well, and I think it saved lives too, because if it's thousands of shillings and a long distance to go to a hospital, antenatal care, prenatal care is something that's so important. So that's one service outside of all the infectious disease that you treat. Everything here brings it close to home. And like you pointed out, there's not an ambulance service. People have to go where they want to go, typically on the back of a motorcycle or a boda.
Yeah. So it has really helped the community in getting access to medical care services, especially those people who really need urgent care. There are conditions that can't wait.
Right.
Yeah, so we can manage those emergencies from here before they are referred to a bigger hospital. And we make proper referrals. At least we've saved lives of people, like those ones who have really chronic care conditions. At least we've been able to identify early before sending them to a bigger hospital for further investigations.
Right. And ideally, if we catch them early enough, we try to keep them out of the hospital so they don't need the big resource, but in a small clinic like this, you've been able to help lots of people. And I thought it was interesting the comment about the motorcycle. Earlier today, we had a child who presented who's very ill, very dehydrated and sick. And at home, we would call an ambulance to transfer. But here, there's not an ambulance service. And the child, it would have been very hard for the mom to just automatically take the child directly to a hospital. But by being here, you were able to see the child along with me today because I'm here. But we were able to identify a very sick child. And then the mom hopped on the back of a motorcycle taxi, the boda, to take the sick child to the bigger hospital. And then the foundation that we work with can help
really
cover some of the costs.
Sure, yeah. It has done a great job in this place because surely people here most of the time, even the source of employment, they do a lot of digging and the source of income is not there, the standing source of income. Poverty is too much. So sometimes these medical services we bring closer to them, they really help to at least to save lives of these people in these communities, in the villages.
Well, and I just want to highlight you, Maureen, like sometimes people will criticize mission-based medicine where you go to do a medical service because we can't be here all the time. But you're here frequently, and you're able to really, we're here to kind of support your efforts so that you find people who are the sickest and help keep them so that they stay out of the hospital-based care and try to do your very best to keep the population very healthy. So you're the one who have the boots on the ground, who's here frequently following up with those people.
Yeah. The best we do, most of the time we give health educations to those communities, how to prevent malaria. Sometimes we even give out mosquito nets.
Oh, mosquito nets, yeah.
We gave out mosquito nets. Yeah, they gave out mama kits for those mothers, pregnant mothers. At least we try to health educate them, at least to come in case of anything, early seeking of medical care. Yeah, preventive services we always offer. So,
wow.
Yeah, we do.
What do you think the value is of, you partner with the foundation, Child2Youth Foundation, and then you have outside groups like us come in and help. What do you think the benefit is for what you do of having a foundation or groups like us from the United States who come and help?
These groups, they do a tremendous work. They do some good work. Surely, because sometimes these people, they come, present with like cancers, they present with those chronic serious cases. Like today, we've identified a patient of ectopic pregnancy.
Yeah,
she came
exactly.
with lower
Ectopic
abdominal
pregnancy.
pain. Anything could happen.
Yeah.
But because she just came and she was taking it lightly, but it was a serious condition, and we saw it was an emergency, but she had no transport to the facility.
Right.
So this foundation, at least it has supported her to get the best medical care because she has gotten the funds for the transport up to the facility where she can do the abdominal ultrasound scan. So these foundations are really doing some good work and supporting the communities. The vulnerable people are really benefiting from these foundations.
Yeah, well, and I think that when you're trying to build something that's going to produce a long-lasting result where you really help people get out of that horrible poverty cycle and lift themselves back to where they can care for themselves, health is one of the big things. And so the foundation, Child2Youth Foundation, which we work with, helps with education, clean water, healthcare systems, and then they do projects like with cows and pigs and goats so that people can build sustainability. And it just makes a tremendous difference for people. Your influences, I mean, tens of thousands of people. And this week we'll go to multiple communities, and I know that we'll serve so many people.
Yeah, surely it has helped. Because we see most of the students from those schools, they have some infections.
Yeah.
But once they are sick and they get proper medical care, the organization is really doing some good work, assisting those children, right from poverty, from home, the school, then from school, medical care also accessible. So they are doing well, and
it's
we
awesome.
Appreciate the services they offer.
Well, Maureen, thank you for taking the time. I just want to commend you for what you do, and I appreciate you letting us work alongside you this week. And I would invite any of our listeners who are interested in international work to look into it. There's lots of opportunities to get involved with organizations that extend this type of care to communities, and they are very mission focused on health education and good outcomes for people who live in low resource environments. And it's been my privilege to be here many times over the last 10 years. And it's been great to work with you these last couple of days. So thank you so much.
You're welcome. Thank you too.
Thank you,
I
Maureen.
appreciate. You're welcome.
Thank you.
Okay, you're welcome.
Thanks for tuning into the Doctors Making a Difference podcast. And thank you for what you do to help your patients and your community. Your work truly helps so many people. We produce this content to help you have the tools you need to stay in medicine and to highlight the amazing work being done by physicians around the world. Please note that while I am a physician, and many of the guests on this program are also physicians or other professionals, the discussions on this podcast do not represent my employer or any professional organizations to which I belong. This podcast is for your information and entertainment only, and should not be taken as professional advice. You should seek appropriate professional advice pertaining to your own situation. Please check out more of our content on our website, doctorsmakingadifference.com. Also, please follow, like, or subscribe on your podcast player or YouTube channel, and give us a 5-star rating. It really helps to spread the message. Finally, if you'd like to be a guest on the podcast, or if you'd like to nominate someone else to be a guest, please visit the website or email admin@doctorsmakingadifference.com. See you next time.